What's your message for people and families affected by the aged care deaths in particular that have swept through Victoria now?
Well, obviously our condolences go to everyone who's lost a loved one through the impact of the pandemic, particularly in aged care. It's a very, very traumatic and tragic time for anyone who's close to this. I know that residents inside facilities across Victoria are concerned, they're frightened in a lot of circumstances, and it's a very, very difficult time for them and also for staff who are also very, very concerned about their own welfare and safety. So I share the sentiments of the Prime Minister that our sincerest condolences to all of those who have been impacted and our assurance that we continue to do everything possible in the interests of those who are in residential aged care.
We've got help sent in at the Duta Gala in Victoria. What's the process for this being triggered? Is it the facility asking the government? Is it a rate of infection in which the government intervenes? How is this working now?
Well, we continue to monitor each facility on a daily basis. We have a case manager on each site. We get a report back from them every day, multiple times a day if necessary, and the Victorian Aged Care Response Centre continues to monitor the conditions inside. We have a process, as you're aware, of transfer to hospital if that's part of managing the capacity of the facility to provide care, to take the pressure off. And of course, we have the various measures of surge staff. We have our AUSMAT teams, our first responder nurses, and also our surge workforce to make sure that we have capacity in the facility. So it's a range of things, but we're in daily contact with the facilities, and it's all of those things combined, of course, along with the assistance and oversight of the Aged Care Quality and Safety Commission.
And when you mention their ability to take residents to hospital, Greg Hunt has said, reported today, is saying a formal agreement. There is now a formal agreement. Any aged care resident with COVID-19 can get treatment in hospital. Was that not previously the case?
No, that's always been our position, that anyone who needed to go to hospital should go to hospital. And that's one of the
Your
reasons...
position, but was it always something the states were pledging to do?
Well, that's one of the reasons that it's not the automatic case for a COVID resident, but anyone who clinically needs to go to hospital. I'm not aware of anyone who's been refused that in a clinical sense. There are some who think that every COVID positive case should go to hospital. That's assessed on a case-by-case basis, and we've discussed on a number of occasions the inputs to that, including the capacity of the facility to manage, the capacity to cohort and isolate within the facilities. There's a range of considerations with respect to sending residents to hospital, and in some circumstances we've got a number of COVID negative patients or residents who are in hospital, so that we can use that transfer to hospital process as a mechanism to assist the facility to manage safely in the provision of care. And of course, at Duta Gala, there's only COVID positive residents that remain at that facility, and the removal of the other residents to hospital has been a part of the process in assisting to ensure the level of care in that facility.
When we talk about the issues being faced right now, and again going back to that apology on Friday, the Prime Minister said in so many cases these are unforeseen circumstances. Council assisting in the Royal Commission said of the problems being faced, none of the problems were unforeseeable. Who's telling the truth?
Well, I don't think it's a matter of contest in that context. I think the Prime Minister and health officials have been working on this assiduously right through the period of the pandemic. There are some unforeseen circumstances. I don't necessarily completely agree with Council assisting, as a number of others don't, and we've put our perspective quite clearly on the record in that context. There are unforeseen circumstances. We've acted continuously to learn from...
Such as what, Minister? What were the unforeseen circumstances?
Well, I think the circumstance we saw at St Basil's, where every single worker on the site, including management, were regarded as close contacts. We understand the rationale behind that now. We have the opportunity to look back, but it certainly wasn't a circumstance that we'd seen before or we had foreseen. And so there are things that have
right.
cropped up along the way.
Just on that one, while you've mentioned that one, sorry.
Yeah.
So Newmarch House and Dorothy Henderson in Sydney, in this initial outbreak in New South Wales, that happened there in terms of those staff numbers being down to almost zero. I think 84% of staff taken out in one and nearly 100 in the other. So didn't we know about this same issue ahead of what happened in Victoria, and couldn't things have been done to make sure that situation was catered for in Victoria?
Well, the circumstances of the two were quite different, Tom. Firstly, the administrative staff at Newmarch didn't get taken out. They still had their management there. They still had their back office there. At St Basil's, everybody was declared a close contact, and so we had to replace the management, the catering, the cleaning, everybody in that facility, and that hadn't happened before. So it was very different, and the circumstance around capacity and staff availability were very, very different as well. We have got a significant issue with respect to staffing capacity and workforce capacity in Victoria right now. It remains a very, very tenuous situation. We've requested assistance from other states, and that assistance has started to arrive now into Victoria. And of course, you also have the circumstance in Victoria where they've got a significant level of infection in their healthcare workforce. And for some of the workers in residential aged care, you're drawing from exactly the same workforce. So the entire health and aged care workforce in Victoria is under stress.
Isn't that something that's happened all around the world, though, with every outbreak of COVID-19, that same impact has been felt?
It has in other cases, yes. And as we've felt the effects of that, we've continued to respond. And as have other states and territories in providing us with resource. And of course, the bringing together of the Victorian and the Commonwealth Health Systems, the Aged Care Quality and Safety Commissioner and other services through the Victorian Aged Care Response Centre has been a part of having effect of that to ensure that that body has the capacity to make the appropriate decisions as a decision-making body with respect to hospital transfers or other resources that might be required by individual facilities.
You mentioned they're disagreeing with some of what Council Assisting is putting forward in the Royal Commission. Is it possible we're going to have a Royal Commission whole series of findings the government disagrees with?
Well, look, I think our disagreement was with the assertions made by Council Assisting. We note the comments of Commissioner Pagone at the end of the hearings last week. We'll consider those very carefully, as we should. But with respect to some of the comments, particularly specifically from Council Assisting, they were the comments that we took issue with. Those things have been countered by not only Professor Murphy but by the Prime Minister and others.
What's your pledge then on the recommendations we're going to get around adopting them?
Well, we're already preparing and watching very closely the work that the Royal Commission is doing. Obviously, the fact that we called the Royal Commission was an acknowledgement that there were issues in aged care in the first place. So no one's ever pretended that the sector's been perfect. There were issues that we wanted to address and deal with, and that's why we called the Royal Commission. So we'll be working very closely to watch what the Royal Commission says, and our objective is to be as prepared as possible to respond to the Royal Commission as quickly as possible, including all of the types of issues that we expect that they'll raise.
All sorts of warnings about help desperately needed now in the sector, though. We had the apology on Friday. Can we expect a funding announcement soon? More money, for example, in the October budget?
Well, we continue to monitor the circumstance of the sector. It's important that we do that. We respond to the issues that arise, and we've continued to do that. We've looked at the learnings from Dorothy Henderson Lodge and Newmarch, and a lot of those have been applied in our response in Victoria already, and we will continue to do that.
Is there a big package being worked on right now, though?
Well, obviously, the resourcing of the aged care sector, the structure of the aged care sector is something that will be an important point of policy for us once we get to the end of the Royal Commission and their recommendations. And of course, we're preparing for that.